clinical emergency medicine and hyperbaric medicine physician who, following the work of his mentor, Dr. Richard Neubauer, helped pioneer the treatment of adult and pediatric brain injury with hyperbaric oxygen therapy. He is the co-author of the book, The Oxygen Revolution, a clinical professor of medicine at LSU School of Medicine, New Orleans, and maintains a private hyperbaric medicine practice through Harch Hyperbarics. Dr. Harch is from New Orleans, which means he has to be a New Orleans Saints fan because my son is the greatest New Orleans Saints fan. And if you read my book, those of you that are from Austin, Drew Brees wrote the foreword to my book. I'm honored to bring Dr. Harch up to speak to us.
Good to see you. This is wonderful. Thank you. Well, let me put this one down. It's working okay. There we go. First of all, it's great to be here. It's a real honor and a pleasure to support Team Luke. Long story to all of this, and I'm going to tell a little bit of it as we go along here, but one of the kind of exciting things, and you'll probably meet them afterwards, is that a number of my patients traveled some distance to come here today. From New Mexico, Dallas, let's see, where else? Let's say Oklahoma. Oh yeah, here we go, Arkansas, and you're going to see CARLSON's. How are you? Anyways, you get to talk to them a little bit. This therapy totally changed their lives, and of course it changed mine. Well, let me start, and let's see. We'll get all our equipment here. All right. I didn't put my LSU thing up here because this is really coming here to make more of a private presentation, and they don't sponsor this. So what I wanted to do is try to go through pediatric brain injury, or just brain injury in general, and draw some conclusions about this. But I wanted to characterize pediatric neurological injury as wounds to the brain. And you'll follow the argument here. And I want to also show that hyperbaric oxygen is treatment for wounds anywhere in the body and of any duration. And lastly, I want to show you with some cases and some videos and so on the profound effect this can have on children's lives and just totally change the trajectory of their lives after brain injury. So first, start with SPECT brain imaging. This is brain blood flow imaging, and any of you who have looked on the internet have probably seen some of these images. You know, MRI and CT are anatomic images. They give you a geographical picture, an anatomical picture where things are, water density versus fat. And functional imaging is Googling down with live Google Maps and seeing the wind and the rain and the people and the dogs and the cats, all the activity, what's going on in the brain. And the question has always been, well, what's a normal one? So these are kind of standard scans, and you're not going to need to be a radiologist to understand this. But the orientation is the person is laying with their head in the plane of the screen up there. And at the very top, our laser light doesn't work, but at the very top in the left-hand corner is the first slice. And so it's slicing from the top of the brain down like a stack of pancakes. And the color map is highest brain blood flow is that white, and then it goes down through yellow, orange, purple, blue, and black. So a normal person, this 35-year-old guy, I recruited 85 normal people and brain scanned them years ago, is kind of a smooth, homogeneous, near constant color, maybe 2 color variation. And here's the lower half of the brain. So again, stack of pancakes. This bottom one is right through the very bottom of the brain. And the computer can take the very outer rim of it, the absolute shell of the brain, and make a 3-dimensional rendition of it. So that you're looking straight on at the person, and the big area in the front is right behind the forehead, and these 2 areas on the lower part, the eyes actually sit right in front of that. That's a normal looking brain. Okay. So I want to show you some cases. Here's a little 5-year-old quadriplegic CP boy who can only speak 2-3 word couplets of speech, only when prompted, has no abstract thinking. His dad heard about hyperbaric oxygen based on some children that I had treated, went and got 21 hyperbaric treatments, and next thing you know, this little child is feeding himself for the first time, initiating conversation, explaining himself, understanding concepts, having imaginative thinking, just an amazing transformation. He got another 21 hyperbaric treatments. He was conversational, speaking sentences, started using his hands. This is a quadriplegic, 4-extremity, very little motion, and very tight and spastic. Well, because of the early imaging we had done on it, Dad decided to get a SPECT brain scan, asked the doctor to order one ahead of time. And these are not the complete images, but I want you to key in on the top one, the third image. If you look at the very top there, the yellow, and just go over to the right, you see there's a dark blue hole compared to the opposite side. That's the speech motor area of the brain. It's not working in here. You can see the color map on the right-hand side up there. The yellow is high blood flow. Down at the bottom, blues and blacks are no blood flow. Actually, black is none, but you see it's blue. It's a damaged area. It's not working right. And here he was after 42 hyperbaric treatments. And we call that a janitor case. Radiologist sitting there reading the films. Janitor walks by and is sweeping the floor and looks at it and goes, hey, look at that scan, looks better. I mean, you can read it from across the room. You don't have to be a radiologist here. But if you look up on the top there, we'll actually go to the second row and the last image on the right, and you'll see that same area, which was blue before, is now yellow and has function. And of course, he's speaking. He's talking. All consistent. Here's a 19-year-old male, 6-year history of polydrug abuse, 2,000 doses of the date rape drug, using it on himself. But what he was using it for was it induces loss of consciousness. And in the seconds before he goes out, that kind of hypoxic high is what he was after. 2,000 times. Plus all sorts of other things. And by the time, 3-4 years of this had gone by, all sorts of cognitive problems, behavioral problems. He's a mess. Actually, he's in prison right now. But he did 35 hyperbaric treatments. He was the son of a colleague. And the doctor called me up and asked about treating him. And we treated him, improved mood, behavior, cognition, and motivation. Well, there's his brain scan. Look at the slices on the right. It's just a ratty, irregular appearance of brain blood flow. And there's the three-dimensional imaging. That's a 19-year-old kid. And here he was after 35 hyperbaric treatments. Not normal, but much improved. Problem was he ended up relapsing, got back into drugs. We didn't get to retreat him. And he finally ended up in prison, and he's there today. 3-year-old girl. Mom had toxemia of pregnancy, fetal distress, precipitated emergency C-section. Child was born 3 weeks premature and not normal. And of course, as she grew older, it was very apparent. Developmental delays, extensive evaluation. First year of life, they diagnosed her with pervasive developmental disorder, autism, and mild mental retardation. She walks on her knees, doesn't make eye contact. She's afraid of people in crowds, can't do any activities of daily living, dress herself, do anything. Self-abusive, biting, injuring herself. I did a series of hyperbaric treatments in 2 blocks with her. At the end of it, walking with a walker, making eye contact, interactive, just a global transformation of this little girl. 7 months later, fully ambulatory. It's like she'd been jump-started. And continued improvement in all areas. Here's her brain scan. And in autism, the one common finding in every study where they have done this type of blood flow imaging on autistic children is in the temporal lobe. So if you look down on the bottom of the brain there, the 2 curved structures, those are temporal lobes. And they should be kind of like a hot dog bun. It's a cylindrical structure, as you remember the normal I showed you earlier. And you can see how these are just carved out and abnormal. Well, here she is after 1 treatment. And there she was after 80. A global change in brain blood flow. Also on the slices on the right-hand side, you can see, well, there's some change there. It's a little harder to see on the slices, but the point is the three-dimensional one really brings that home. traumatic brain injury. This is 1993. It's a 19-year-old who, he was 16 at the time this happened, and severe motor vehicle accident up in Canada. Jaws alive, they had to pry him out. He was in the car for over half an hour, comatose already. Ended up prolonged rehabilitation, and nearly 3 years later, parents brought him down. And it was funny because I was in the mountains with a group of people, and this one guy in the group, turns out, was his father. And this was right after I had treated one of the patients in this room that just totally transformed my whole life, practice, everything. He's right here. And I was just high as a kite. We had made this discovery. And we were all standing around and talking, what do you do? What do you do? And I was telling the story, and I said, we have a treatment for brain injury. And he said, well, how about my son? And told me his story. I said, you know, give him a call. Let's see what we can do. Brought him down. He's walking and talking, but he is so socially inappropriate. He has frontal lobe injury, among other things. Social behavior is just way off, laughing inappropriately, you know, in a group of people. Cognitive deficits, asking and repeating the same things over and over and over. You can imagine his mother is just driving her crazy. And he requires 24/7 supervision. He cannot be alone. Brought him down, imaged him, treated him over a series of about 8 months. Improved cognition, perseveration, behavior, ended up in a group home, got a job, and they had done neuropsych testing on him. But I have him on video when he came back for some additional treatment. I asked him, well, Graham, why do you keep coming here for hyperbaric treatment? That was his quote. I feel so much better in my head and can do new things when I have the HBOT. Well, here are his images. On the left-hand side is before hyperbaric treatment, and you can see the kind of ratty, irregular appearance. On the right is after one hyperbaric treatment. Global improvement in brain blood flow. Here's the lower half of the brain. Left side before, after one treatment. But what I want you to look at is up on the top row. If you look at each of those top images, let's take the third one. The very, very top left-hand side, you see the dark purple area, and the mirror image frontal lobe just opposite it is all yellow. What he's got is a very focal injury. There are among others, I can point them out to you, but in this right frontal lobe. After one treatment, look what happens. That area starts functioning metabolically. Here he is now before and after, I think it was 70 hyperbaric treatments. And I'm going to go down to so before on the left, after the 70 treatments, and take a look what's happened to his frontal lobe up there. The right-hand side, top row, the first two images, they're symmetric. He's markedly improved. Well, he had neuropsychological testing before and after. And on the top row is before hyperbaric treatment, and this is called the Ray-Osterrieth complex figure drawing. It's a memory test. And what they have found is it's very specific to frontal lobe function. And so what happens, they give them a figure and they show it to them, and you sit there and you copy it. That's the first image in the top row. Then they take it away and they ask you from your memory to try to reconstruct it. You see what happens, he loses detail and the size gets smaller. And then 30 minutes later they ask him to draw it again, and you can see it's looking more like a rocket, a little spaceship. Here he was after hyperbaric treatment. The copy, immediate memory, and 30 minutes. This has never been shown before. I mean, it's very hard science. Functional imaging and the function that goes with it. 1999, little cerebral palsy child, 8-year-old boy, hemiplegic, one side of the body not working, minimally working. And he has all sorts of problems, spasticity, uncontrollable behavior. He's very irritable, attention, concentration problems, cognitive deficits, autonomic injuries. So many brain injured children are very constipated. The brainstem function controls autonomic function for the intestines is also injured, and net result is constipation. He's also incontinent. 8-year-old boy, you know, still having parents change diapers. Brought him down, imaged him, treated him, gave him 80 hyperbaric treatments, and he was improved in all of these functions. And this is another janitor case. Here are now side images, so you can slice the brain ear to ear, front to back, like a loaf of bread and a stack of pancakes. This is looking side to side. So here he is before, 1 hyperbaric treatment, 80 hyperbaric treatments. You can all be a radiologist now. And here's the 3D. Take a look at the temporal lobes on the bottom, after 1 and after 80. That is a pretty normal looking brain. So if you look at all of these things, and I could show you hundreds of cases, we can kind of break them down into 2 categories, neurological and intellectual disability. Neurological disability is any impairment or limitation due to injury or illness, and Tim Siegel asked me to talk about acquired brain injury. So something that happens to you, not necessarily a congenital malformation type of thing that occurs in utero. But neurological disabilities can affect 1 or more of the following areas: memory, cognition, sensory, motor, speech, language, organizational skills, information processing, affect, etc. And there's a long list of them. I just put some of them up here. And in yellow are all the ones that affect children. CP, muscular dystrophy, traumatic brain injury, Tourette's, fetal alcohol, epilepsy, learning disability, attention deficit, autism. Those last 3 comprise a significant proportion of children that I see and that have problems. And intellectual disability, though, is a little more specific. It's injury enough that IQ is significantly low. The lower limit for normal is 80. So this is down in the 70-75 range or less. And they have significant limitations in 2 or more adaptive skills that become manifest by 18 years of age. And the adaptive skills are communication, self-care, home living, etc. You can read them there. Turns out there's several hundred causes. 3 major ones are Down syndrome, fetal alcohol, and a chromosomal disorder called Fragile X. But you can categorize these intellectual disabilities in a number of ways. You have genetic causes, we have problems during pregnancy, alcohol, drugs, malnutrition, infections, other illnesses that mom can contract during pregnancy, HIV infection, problems at birth, something happening, the birth event, more common than anybody wants to admit because of the liability situation. And so a lot of times the difficult births and the problems that happen, the APGAR scores are abnormally elevated and it's concealed to avoid lawsuits. But you can have then problems after birth, infectious problems, all sorts of different things can affect a child. Poisoning, trauma, drowning, very common. And then the problems that are associated with poverty, malnutrition, poor environmental conditions, health hazards that cause health hazards, deprivation, social stimulation, abuse. All of these things can cause chronic intellectual disability. But if you look at all of them and all these causes, they have a couple things in common. They are all due to injuries to the brain of one type or another. It can be toxin, it can be mechanical trauma, it can be low blood flow, low oxygen, a variety of different ones, but they all cause organic injury to the brain, some physical injury to the brain. And regardless of the type of injury, it doesn't really matter. I mean, there's some differences with the type, like a toxin versus a trauma versus low oxygen. The second you impart physical damage to the brain or any part of our body, what takes over? The inflammatory reaction. You can't stop it. And it is stereotypic. And it dominates the process from there on out. So it's kind of like a DVD. You plug it in and every time it plays the same movie. Inflammation, the inflammatory process. And what happens is the net result is acute wounding that then proceeds to a chronic wound. And it's this wounding process that is the target of hyperbaric oxygen, regardless of where it is in the wounding process, immediate, subacute, or chronic. So that gets to the question, what's hyperbaric oxygen? And I'm just going to tell you, nobody has been able to understand this or define it for 357 years until now. And this is the unfortunate definition that has driven the field for the past 50 to 60 years in the United States and even worldwide, and has led to all of the confusion about this therapy. My third year in medical school, I was told in no uncertain terms this was a complete fraud, unscientific, charlatanism, snake oil sales, and just had been thoroughly disproven. So look at this definition. It's a treatment in which you breathe 100% oxygen intermittently, meaning once a day, twice a day, whatever, while in a treatment chamber at a pressure higher than sea level. Not necessarily true, and it can be viewed as the new application of an old established technology to help resolve certain recalcitrant, expensive, or otherwise hopeless medical problems, and the pressurization should be at 1.4 atmospheres or higher. This is totally arbitrary. I mean, what's a recalcitrant, expensive, or otherwise hopeless medical problem? It is every chronic medical condition. We have no cures for any chronic medical condition, any long-standing condition. So this could be really anything, but no, that word certain. Where did that come about? Well, the FDA in the late 70s was trying to grandfather in and approve hyperbaric chambers for all drugs and devices. And chambers came into the United States around 59, and the FDA really knew nothing about it. People were using it, billing for it, and there was a lot of confusion. And so the Food and Drug Administration said, well, what is this good for? They went to a group of hyperbaric doctors and they asked them, what's this good for? And they said, oh, these 13 things. And they gave them, uh-oh. I don't know how that happened. My spasticity. There we go. They give me this list. So I want you to look at these things. Air or gas embolism, that means air in your arteries going to your heart or your brain. Carbon monoxide. Gas gangrene, you know, this from war wounds and trauma, terrible infection, you have to amputate, people die from it. Crush injuries, or loss of blood supply from trauma. Decompression sickness, the bends. Selective wounds, diabetic foot wounds, arterial insufficiency wounds, venous stasis wounds in your legs. Severe anemia from blood loss. Now, try to connect the dots between all these. I mean, it's a disparate group. No doctor has been able to do this. Necrotitis soft tissue infection, that's the flesh-eating bacteria. Chronic bone infections, radiation injury, compromised grafts and flaps that aren't healing, burns, brain abscesses, central retinal artery occlusion, which is stroke of the eye, sudden blindness, and the last one is idiopathic sudden sensory neural hearing loss, sudden deafness. Now, I challenge you and anybody in the medical profession, how do you get a list like this? What's the connection? That definition made no sense, but this is what they were treating, found out at work. The FDA stamped the chambers and labeled them for those diagnoses. But if you go to Russia, there's 70 diagnoses, 49 in China, 36 in Japan. How can a scientific definition change as you cross country borders? I mean, Newton's laws of force, an apple falls the same in England than it does here from a tree. It's unscientific, it's grossly unscientific. And so this has confused the field all of these years. So in 1998, I was asked to write a chapter for the International Hyperbaric textbook, and we set about, Dr. Neubauer and I, trying to define this scientifically. Well, what we're doing is we are using greater than atmospheric pressure and oxygen to treat disease processes, such as inflammation, and thereby you treat the disease. And it's been modified a little bit, but what it leads to is we can treat wounds, or you can apply this to wounds in any location in the body and of any duration. It's generic. And in fact, the way this affects us, as you're going to see in a second, is at a very, very basic level, common to all living organisms. And it goes back to creation, or if you believe in evolution, you know, the way we were either built, designed, or evolved to be sensitive to changes in atmospheric pressure and oxygen levels. Go to altitude. You've got to be able to survive at altitude. How do we do it? We have adaptations, and it's genetic. Underwater, if you believe in evolution, where did we come from? It came out of the ocean. It's been shown now that animals, the sea life and plant life, live at different levels depending on the water pressure. So what's the mechanism of action? As it turns out, it's gene therapy. Nobody has understood this. And in 1994, we've always known if you do the input, a daily exposure to hyperbaric oxygen for a wound condition, the output is a healed wound, meaning you grew tissue and the wound healed. Well, how do you stimulate the body to grow tissue? You have to go through the nucleus. You have to be able to make the cell divide. And so all these years, nobody really kind of put that together until finally, 1994, a plastic surgeon, they were working with just giving supplemental oxygen to rabbits that they made a wound on their ear. And they were using growth factors, and they found the growth factors help heal the wound. Growth factors are proteins that are coded in our DNA. And if they gave supplemental oxygen, it also sped it up. But if they gave oxygen with the growth factors, it really sped up. And they said, wait a minute, growth factors are acting at the DNA level to cause changes. The oxygen must be doing the same. And so somehow, oxygen is affecting our DNA, the expression of genes. Well, did anybody look and see who won the Nobel Prize just last month? The guys who had worked with and discovered oxygen signaling, how oxygen signals each of our cells to do the things that it does. Well, I guess they've been working on it 20 years. Well, this was known in hyperbaric medicine back 1994. So what is that, 19 and 6, 23 years, or 25 years now. And what they proposed was oxygen, and hyperbaric oxygen was a DNA signaling agent. Well, I couldn't conceive, how can you change the DNA code with giving someone some additional oxygen? You can't. Our DNA code is fixed, get it from our parents. But when I was in medical school, we were taught that, what are your genes good for? Making new people, you pass them on. But in fact, at every second, right now, all the genes in all of our cells are being read, proteins made. It is a constant activity. And the DNA is in a coil. And in the middle of that coil are these proteins. And the proteins, it turns out, are affected by pesticides, food additives, stress, environmental conditions, alcohol, drugs, tobacco, everything. And they alter the conformation of these proteins. But what happens is these proteins control which genes get read, turned on, or which get suppressed. And when you damage those proteins, you can lock down a gene, it doesn't get expressed, you have disease. Or you can overexpress a gene. It turns out hyperbaric oxygen is somehow affecting these histone proteins, they're called. We don't change the DNA code, but if you change those proteins before you reproduce, in fact, you can inherit that, such that acquired traits that parents have can be passed on to children, but not be embedded in the DNA code. So what happened? Finally, in 2008, molecular biochemistry caught up to hyperbaric oxygen. And some doctors up in Massachusetts took some human tissue and they ground it up and they isolated the cells that line our smallest blood vessels, which are amongst the most active cells in our body, controls nutrient flow across our blood vessels, oxygen, everything, the immune system. And they put them in a petri dish, stuck them in a chamber, and gave them a single hyperbaric treatment and measured all of the gene expression for 24 hours. And what did they find? Over 40% of all the protein coding genes in our DNA were turned on or turned off with one hyperbaric treatment. Now think about that. That is 8,101 of the 19,000 genes in our DNA are sensitive to oxygen and pressure. And what they found were the largest groups of genes that were turned on were the anti-inflammatory genes and the ones that code for growth and repair hormones, i.e. heal wounds and tissues. Largest cluster turned off were the pro-inflammatory genes and the genes that are responsible for programmed cell death. So every time you go in a chamber, we're stimulating tissue growth, inhibiting inflammation, and turning off cell death. Voila. Which is what's happening to those children. So what we have is the oldest, most enduring, most effective gene therapy known to man. And it's been around since 1662. And we just haven't understood what we're doing. And so I tried to characterize this in an article I wrote for the Townsend Letter, which is a professional journal for alternative health. And they have feature articles on all sorts of things, but essentially what we're doing is playing a symphony with patients' gene expression, the music of which is determined by the amount of oxygen and the amount of pressure. Well, how do you dose this? It turns out every human being is idiosyncratic. Your DNA makes you a very unusual person. There's nobody like you. And that affects our brain, our liver, our everything about us. If you now have an injury, I don't care what it is, because of your anatomy and your individual characteristics, that injury is going to be very specific to you, meaning no one else is going to have the identical injury. So if you get punched, two people get punched, the same punch is not going to have the same effect. And what you end up with is idiosyncratic times idiosyncratic. Your final injury or disease process is specific just to you. And of course, what we try to do in medicine, and always have done, you try to treat the person, that individual person. And that's the practice of medicine. And that's what we're doing with hyperbaric oxygen. Well, traditionally, what's happened is people didn't understand what hyperbaric oxygen was. And over time, they found that if they did things in a certain way, it kind of worked. So those became protocols like cookbook, very, very rigid. And it's more so true lately because of the internet. It's out there everywhere. And everybody wants a protocol. We plug it in and you get the result. Well, in 1989, we started looking at neurological conditions and individual dosing. And for 10 years, we looked at one dose for every neurological condition, just to see what might work for that dose. That it turns out seemed to be pretty good. But over the years, then, we found that you have to adjust this for patients and their individual problem. And what we did was we did this based on my mentor, Dr. Richard Neubauer's finding, where he had taken a lady who had a stroke 14 years before. They did the blood flow imaging on her. The next day they put her in the chamber at a dose of hyperbaric therapy, took her out and re-scanned her. And right in the middle of what on CT scan looked like the dead brain, this island of tissue lit up. And it turned out it was the area that controlled facial and oral motor function. Now, she was paralyzed on one side, couldn't talk, constantly drool, couldn't chew, swallow, eat. And after they treated her with, and everybody has ignored this, intermittent oxygen at the nursing home and hyperbaric oxygen, she stopped drooling, started swallowing, got some speech back, was able to move her face, and they could get her up with assisted ambulation. And it was all because they identified an area that truly wasn't dead. So what we did was we looked at every patient that got referred with scan, one dive, rescan. And this is a perfect example because whenever you do have an injury, a focal injury, the area that has the greatest part of the injury can die, but the surrounding tissue can be injured and not yet dead. And it can exist in that state for many, many years. The longest time we've now seen, I think, is 50 years. We treated someone 50 years after injury. And so this is a 29-year-old lady who's 6 years after she tried to kill herself. And, pointing it straight in at the last minute, I think she, got scared, and anyways, it got pointed up. So you can see the path of the bullet went in the right temple and up around the top of the skull. But that's the blast path. Take a look at what happened after one treatment. A whole lot of brain tissue now working better. And as we treated her over time, she did better. But the thing about this was this scan, dive, scan sequence. What we did was take that picture 3 to 4 hours after she came out of the chamber. What that picture represented was what happened in the chamber and the delayed effects that we could never look at what was going on with the brain in the chamber with that dose of oxygen until now. And now what we have is quantitative EEG with a wireless headset where I can look at live brain activity, put you in a chamber and turn the gas, the oxygen, and the pressure and look at your brain changing. And what it does, these are a lot of numbers and colors and everything, but across the top, we have 5 frequencies of electrical current in our brain. The lowest, delta, theta, alpha, beta, gamma. And the 3 higher ones are our thinking frequencies. And the lower ones are more, well, everybody has all of them, and our brain is in balance. But when you're injured, you knock the brain down into these low frequencies. It's like idling speed. And that's what the left one is. If you see on the far left there, the color code, that bar below it, these are standard deviations from normal. It's immediately compared to normal within 30 milliseconds. And all of that white is 4 standard deviations above normal. It's like 0.01% of the population could have that as a normal finding. For all intents and purposes, it's very abnormal. And the map, the second row of, you can see the ears and the nose on it, we're looking down on the top of the brain. All of those little tinker toys are the connectivity. The white matter tracks between all the areas on the brain. And then the numbers below are also the standard deviations. Well, here is someone before and after, or while they're in the chamber, excuse me. And if we look at just the top row on the left-hand side, you see the delta and you see the reds, which are very abnormal. It's 3 standard deviations away from normal. And there it is in the chamber, changing live. That is normal. So what we're now able to see is the brain change and pick a dose that might be best for that person's brain. Well, what's the ideal time to intervene if you could? Ideally, it'd be immediately. If we look at this for stroke and level of function or response on the top, that red line is from the time of stroke. You can see the injury gets maximal at a certain point, and then eventually it recovers. Well, the blue one is our brain and body trying to recover and repair. And there's a period of time where it's maximal, and then it drifts off. The time frame there, I'm going to show you quantitatively here in just a second. We can look at stroke again. Let's look at motor function, the red line, normal. And right at the impact on the bottom there is when the stroke occurs. And what happens is we will recover motor function. And the plasticity and ability of the brain to change, though, is maximal early on and then decreases over time. Well, what's that time frame? Generally at about 6 months is where most of that change has occurred. I mean, not exactly, but it's maybe 85% of maximum. So you can see the curve starts coming out and flattening. Ideally, we want to intervene immediately. And in fact, all the evidence points to immediate treatment and can have just absolutely profound effects. Just like we do with diving and decompression sickness, the signature diagnosis of this whole specialty of hyperbaric medicine. But remember, these cases I've shown you, they're all old. And in fact, for 30 years now, I would tell you 90% of the over 2,300 patients I treated have been a minimum of a year out from injury. Most of them, the veteran study we just finished a few years ago, 3.3 years after their blast-induced brain injury. The TBI study we just finished, 4.6 years. And the longest one of the study, I think, was 14 years, or 13 years out. And here's just another thing, looking at inflammation on the top there and how it wanes over time. Remember, this is an anti-inflammatory treatment. You can intervene anywhere, and then the regenerative process as time goes on. So I wanted to finish and show you this amazing case, and she's here today with her parents. Hello, Eden. Eden was 2 years old and had a drowning incident. And this is the paper. You can find it online. It's a peer-reviewed but instant access online journal. So you can Google my name, you can Google her name, actually. And you'll get the article, you can download it. And this is, of course, before her episode. And what had happened, she had an accidental 15-minute submersion in a pool. Mom found her, did CPR. It was continued by the paramedics for 100 minutes. And these values here, Glasgow Coma Scale of 3, that's the lowest. That is someone with just barely vital signs. Actually, her vital signs needed to be supported. Blood pH normal is 7.4, 6.5. Most people can't live with that. Body temperature markedly lower, 11 degrees, or 13 degrees lower. Fixed dilated pupils. She got stabilized and compliments to Washington Regional Medical Center Emergency Department. I mean, this was just a heroic effort, and they saved her. She was transferred, putting on a cooling protocol, which now is done for brain injury, but she still needed blood pressure support, on a ventilator for 10 days. 35 days later, discharged home with an apnea monitor to measure when you stop breathing. And they were sent home, parents with rescue oxygen, so if she stopped breathing, they'd give her oxygen and try to stimulate her to breathe. She was pretty much unresponsive to stimuli, immobile, legs drawn to her chest, constant squirming, head shaking. And they had done MRIs of her brain, and I thanked them for this. They got another MRI right before she got discharged. So 3 days in, and then at the 31-day mark, she got discharged at 35. And 55 days later, I got a phone call from them, or 54 days, from the parents, and we talked about it. And I was afraid of having to put her in a car and drive her from Fayetteville, Arkansas to New Orleans. I didn't want to, accident way out in the boonies. And I said, she's too unstable. The only thing we can do is what Dr. Neubauer did and what I had done with some of our patients over the years. We had her use that oxygen instead of for rescue, to just put it on and use it 45 minutes twice a day. And you're going to see what happened after just 1 or 2 administrations of this. But what happened is she started improving, and over the next 23 days made pretty significant progress, enough to where I was no longer fearful that, they could travel and not get into a problem. And here she is right before the first nasal cannula oxygen, so just look at her. Untitled, I want you to look at her eyes when it closes up on it. But, this kind of uncoordinated and thrashing movement. I mean, she's miserable. Look at her eyes. They're just dull. The light bulb is not on. And this is after now just a couple administrations of a little bit, 30% nasal cannula oxygen. Take a look at her eyes. He's watching the video here. You can't hear it. If you go to YouTube, you can actually, but look at the twinkle in the eyes. She's engaged. You'd have to hear this little bird going on. They've got a video that she's watching. I mean, it is. And what had happened, I told the parents, look, you have a chance here to really make an impact. I want you to record this before and after, because there's a possibility we may see a noticeable change. And thank you, they did that. This was just so dramatic. Well, what ended up happening, she got OTPT and speech therapy added on the 10th day of using the oxygen, and finally 78 days later came down to New Orleans, and what did I give her? Not the high oxygen concentrations that have been used all these years in higher pressures. I gave her the identical amount of oxygen in compressed air. And what happened? Within hours of the first one, her tone had changed. There was increased motor activity. It was a very noticeable improvement, just like it had been done with the nasal cannula oxygen. And as we continued to do this, she made pretty substantial improvement. In fact, at 10 treatments, Mom said, I think she's pretty normal. And I thought, well, I think we could go a little farther here. Mom discontinued all of these medicines she was on. Buspar, which is an anxiety medicine. Propranolol is a medicine that slows the heart down and slows some of this storming activity. Baclofen is a sedative for the nervous system to decrease spasticity and loosen patients up. But she still had some residual emotional gait and some temperament deficits. I mean, she wasn't back to normal. And what I'm going to do is show you the video of this here in a minute. But 27 days afterwards, 162 days after the drowning, so 27 days after the 40th hyperbaric treatment, their neurologist repeated the MRI. And what we saw is something we've seen a couple times before. There was a global regrowth of brain tissue. Neurologists attributed it to God. I won't argue with that. that's fine with me. I want to think the hyperbaric oxygen helps some, but 8 months later, I adjusted the dose, changed it. She had some further improvement, and we kept doing this over time. Another 3 months after the 47th treatment, changed again, made further improvement, and we keep going. And here are her MRIs. So on the left-hand side, this is actually a movie, but and you can watch it in the article, but on the left-hand side is when she got out of the hospital, 4 days before, so this is after the drowning. All of the white on there is the fluid in the brain, cerebrospinal fluid. Normally in a child 2 years old, you should not be able to see but a little slit between the folds of the brain. And the center part, the ventricles there, should be half that size, or even less. And on the right-hand side was after treatment. And you can see that the brain has grown substantially. This has never been seen before. You can't find this anywhere in medicine. Any imaging, any report of it. We actually have a number of cases. And here were measurements. You can see, for instance, the cortical fold, which is the gray matter down here on the left, 2.5 millimeters before, 4.0 millimeters after. This is a 60% increase in width of the brain tissue. And up on top is the main white matter tract, the connecting tract that connects the two hemispheres of the brain, the corpus callosum. And it's 3.6 increased to 4.3 millimeters. This is the video you can watch online. But what I want to show you now, this is going to be the before and after of her when she came to the clinic. And it's in 2 segments. You can watch by her clothes, but you'll be able to see the difference also. And it's a kind of sequence of little maneuvers I'm putting her through to see what her level of neurological activity is. And unfortunately, the video didn't come through, but I'm just talking about this. This is about 5 minutes, and she had a wound on her leg there that was very slow to heal, where they had put resuscitative medicines that had leaked out in the skin and caused skin damage. But, you know, look at body movements, and you'll see her ability to sit or stand. And talking about the wound. I usually try to get them to grasp something just to see coordination of movements. This is a little pinprick tester to see if she'll react to the pinprick. Or actually, it's still a tuning fork. I'm trying to get her to grab it. She won't hold it with the right hand. You see she's, you know, having trouble with coordination and grasp. Finally, gets a couple fingers on it. And you see how she pulls her legs up and they're tight. I'm just trying to see how far we can go to straighten them out. And she doesn't like that. You can see you can't get them straight. She's very spastic. Trying to get her to reach. See if she'll pull. And then checking balance, core balance. Can she sit unattended on the side of the bed? No one's fallen off in 30 years. But yeah. And then I lay them down and pull them up to see what they can do with their head, how much head control they've got. And she's got some lag there, but she eventually can get her head up. And finally, to stand her and see, now she's pretty agitated, but if she'll bear weight on her feet, and you can see she's not doing that. Do additional treatment, and let me see if, can you advance that one slide? There we go. You know, all these years, this has been a tightrope walk in New Orleans. My mentor, Dr. Neubauer, the medical profession really destroyed his reputation because this challenged 100 years of neurology, that there's nothing you can do for a brain injury. And here he was showing that you could treat brain injury. But he was a brilliant man, a very gentle soul. But he was in a private freestanding clinic. So it was very easy for the academics to criticize him in any way they could, despite the amount of publishing he did. Internationally, he was highly regarded. And I thought, well, I can't let the same thing happen. We have to have an institutional attachment. So my senior partner started a fellowship in hyperbaric medicine at LSU School of Medicine in New Orleans. And so since 1991, we have had this training program. I was director of it for 19 years. But the problem is, it was a schizoid existence. I mean, that was done purely just to have some credibility attachment. It'd be easier or more difficult to criticize it. All of this treatment, though, was done in our private clinic for all of these years. And the faculty is somewhat very resentful. And so what happened, at least some vocal ones, the marketing director has watched this over the years. And I don't know, 20 of our patients have gone to the media, to the news, and it's been on television all over New Orleans and radio. We didn't seek that, it just happened. And of course, that even makes the academics more irritable. But because I'm on staff, every time one of these things happens, I have to go to the LSU media liaison person and say, well, you know, the news contacted me, and they make them sign LSU consent forms and all of this stuff. So I said to her, I sent her Eden's case, and I said, you know, I'm publishing this case, this little drowned girl, and what we've shown here nobody has ever shown before. And I said, I don't know if you're interested, but here it is. And she looked at Eden's case and the article, and she said, you just sit back and watch what I'm going to do. And the first time she overrode the institutional resistance. They sent press releases out everywhere, all over the world. And so her case and her story opened the door for so many children. And this was one of them. This was just in the New Orleans Advocate, the local newspaper. I don't know what's happened, I've run out of juice here. Can you advance that again? So just to kind of sum things up, hyperbaric oxygen turns out as a treatment for wounds in any location of any duration. And healing those is all about trying to get the right dose. And there's a range of dosing that people are responsive to. When we look at acquired pediatric neurological diagnoses, the ideal time to do this is immediately. And all of the science and case experience essentially supports that. But again, 90% of the patients that we did this with over the years were all in that chronic, unchanging, flat part of the curve. So if we sum this up, acquired pediatric brain injury is characterized by wounds in the brain. Hyperbaric oxygen is a treatment for wounds in any location in the body and of any duration. Hyperbaric oxygen works by gene stimulation that causes tissue growth, inhibits inflammation, and stops cell death. It's effective for a wide variety. In fact, I think I've treated, I don't know, 30, 40, 50 different pediatric neurological conditions now. And it ought to begin as soon as possible. Thank you.